Hi, this is my presentation for Tuesday, July 18th, 2023. It is titled Disparities in Neuropsychiatric Symptom Clusters Across Dementia Diagnosis within Lewy Body Dementia Syndromes and Alzheimer's Dementia. So, behavioral clusters may differ in intensity and frequency across dementia syndromes and according to genetic variants. But the learning objective is to investigate the differential patterns of clusters or neuropsychiatric symptoms across APOE4 carriers with Alzheimer's dementia, APOE4 non-carriers with Alzheimer's dementia, and patients with Lewy body dementia syndromes, comprising dementia Lewy bodies or Parkinson's disease dementia. We had consecutive outpatients with probable dementia Lewy bodies, Parkinson's disease dementia, or late onset Alzheimer's dementia. They were recruited from 2010 to 2018. All of them were assessed for demographic features and scores on the clinical dementia rating, index on independence and activities of daily living, Lawton scale for instrumental activities of daily living, a 15-item clot drawing test, mini metastatic examination, and desired caregiver burden interview. Clusters were assessed according to the neuropsychiatric inventory. We had the affective cluster comprising anxiety, apathy, dysphoria, and euphoria, the hyperactive cluster with aberrant motor behavior, agitation, disinhibition, irritability, and psychotic cluster with delusions and hallucinations. So, all patients had similar levels of education. Patients with Alzheimer's dementia use cholinesterase inhibitors and memantine more often than patients with Lewy body dementia syndromes. Patients with Alzheimer's dementia had higher index of independence and activities of daily living and clock drawing test scores, but lower caregiver burden. APOE4 carriers with Alzheimer's dementia had lower effective scores, while APOE4 non-carriers with Alzheimer's dementia had lower psychotic scores. Hyperactive scores were not significantly different among groups. The affective cluster was associated with caregiver burden and inversely associated with mean metastatic examination scores only in Alzheimer's dementia, while inversely associated with functionality in dementia Lewy bodies and Alzheimer's dementia. It was also associated with functionality and inversely associated with clinical dementia rate sum boxes in Parkinson's disease dementia. The hyperactive cluster was inversely associated with functionality in all groups, while associated with cognitive scores in dementia Lewy bodies and inversely in Parkinson's disease dementia and Alzheimer's dementia. It was also associated with caregiver burden in dementia Lewy bodies and Alzheimer's dementia, and inversely in Parkinson's disease dementia. The psychotic cluster was associated with clinical dementia rating sum of boxes scores in Parkinson's disease dementia and Alzheimer's dementia, while associated with caregiver burden and inversely associated with cognition and functionality in all groups. In conclusion, the affective and hyperactive clusters have divergent associations with clinical features across dementia syndromes, while the psychotic cluster is most consistently associated with worsened cognition, functionality, and caregiver burden, while APOE4 carrier status may affect cluster intensity in Alzheimer's dementia. Thank you for watching, and I hope that you have an excellent conference.